neurology video series at Teeth Neurology. Let's discuss carpal tunnel syndrome. One of the most common things we see. Carpal tunnel syndrome is a pinched median nerve at the wrist. So right here is where the nerve is pinched. It can be pinched here. And the numbness, the person will have numbness in 3.5 fingers. Doesn't have to be all 3.5 fingers. Can be just the thumb and the index finger. Sometimes can be the index finger and the middle finger. But usually it's a combination of 3.5. Now 1.5 finger is supplied by the ulnar nerve, which comes from behind the elbow right here. And so that's the ulnar nerve. The median nerve supplies these 3.5. Usually when it's carpal tunnel syndrome, it's purely a sensory deficit, whereas ulnar neuropathy can also cause weakness in the hand. Carpal tunnel syndrome usually doesn't cause weakness. The person will say that they have numbness and pain in the hand, usually when they are holding something or at nighttime. At nighttime, because the person often sleeps with their hand wrist flexed, they can get a lot of numbness, and they'll wake up and they'll be doing this and trying to basically wring out the numbness. How do we diagnose carpal tunnel besides the clinical symptoms of numbness in the first 3.5 fingers? We do a nerve conduction study, and the nerve conduction study will not only tell us if someone has carpal tunnel, but also the severity of the carpal tunnel, and that gives an idea also what the treatment would be. If the condition is very severe, then even surgery might not help. If it's very mild, then you can get away with maybe just physical therapy, some vitamin supplementation. Another choice is treatment choice is a steroid injection in the wrist, which can give temporary relief, maybe for about 6 months or so. If the condition is not responding to splinting is basically to keep the hand straight, because when you flex the hand, it makes the symptom worse. So keeping it straight, like with the wrist splint or in neutral position, it helps, especially when sleeping or when doing a task. A brace or a splint can be worn at that time. So if bracing and conservative treatment does not help, the step would be ideally surgery, and I usually refer then the patient to a hand surgeon. But the diagnosis of carpal tunnel is done by a neurologist. The diagnosis is fairly simple. The symptoms are quite obvious, and really nothing else falls in that differential. Sometimes the numbness might not be only in the hand. Sometimes the patient will say that it can go up the arm, but that could still happen even with carpal tunnel.